Good afternoon, everyone. Welcome to today's webinar. I would like to remind you that this conference is being recorded. At the moment, all participants are in a listen-only mode. For those that are connected by telephone and require operator assistance during the call, please press *0. For those online that require assistance, please use your chat box on your screen. I would like to now hand the meeting over to your host, Kimberly Fairman, Executive Director at the Institute for Circumpolar Health Research and a CFHI Policy Circle member. Please go ahead.
Great. Thanks so much. Hi, everybody, and welcome. My name is Kimberly. I'm pleased to host this webinar entitled Housing in Healthcare, Sheltering People Experiencing Homelessness During a Pandemic and Beyond. With my fellow panelists who are here, and in a moment I'll be asking you all to introduce yourselves. I myself am the Executive Director at the Institute for Circumpolar Health Research, and as you've heard, a member of the CFHI Policy Circle. I'm hosting from my hometown in Yellowknife, Northwest Territories, which is the traditional territory of the Yellowknife Dene First Nation, as well as the Northside Métis. The Spotlight Series is a responsive webinar series that raises the voice of Canada's healthcare improvers and innovators to shed light on ways to address the most pressing challenges in healthcare across Canada. Every day, about 35,000 people experience homelessness, and over 235,000 people experience it annually. The COVID-19 pandemic has reinforced what we already knew. Housing is good healthcare. And what the pandemic acutely showed is that having a home could literally be a matter of life and death, as governments across Canada invoked shelter-in-place policies to prevent new infections and flatten the curve. We all may be in the same storm, but we aren't in the same boat. For those who are unsheltered or precariously housed, something as seemingly simple as public health orders to physically distance or wash your hands can be complicated. You can't physically distance if you're sleeping on a mat in a homeless shelter. And it's hard to wash your hands properly if you live on a First Nations reserve under a boil water advisory, for example. The pandemic has highlighted some persistent inequities for certain populations in Canada, as noted by the Chief Public Health Officer, Dr. Theresa Tam, in her most recent annual report. As she notes, we need to improve the health, social, and economic conditions for these populations to achieve health and to protect us all from the threat of COVID-19 and future pandemics. In response to the pandemic, homelessness officials have partnered with health officials, communities, and others to respond to the pandemic, creating more physical distancing at existing shelters, opening new facilities, and creating spaces for isolation and quarantine. Federal and provincial territorial governments have stepped up with significant funding, and many communities and jurisdictions have made hard-won progress. There are bright spots, and we're going to talk a little bit about that today, and lessons learned, but a number of challenges remain, and we may well see more strains in the system as a result of the current second wave and economic downturn. In this episode, we hope to get into these issues and more. We're going to share what's working and have a conversation about what it will take to close the gaps and sustain and build on the improvements that have been made during this time. To get us started, I'm going to turn to each of our panelists to introduce themselves, and what I'm going to do is just work my way across the screen and call on each of you. You could introduce yourself by telling us about the role you play in Canada's housing and health ecosystem, and it'll be a quick round, and I'm sure this hour is going to fly by. So I'm going to start on my left-hand side with Julia.
Thank you, Kimberly, and thank you to the organizers for inviting me to participate today. I'm really looking forward to the discussion. I am Julia Christensen. I'm an associate professor in geography at Memorial University in St. John's, Newfoundland, and also a Canada Research Chair in Northern Governance and Public Policy. And I'm joining you today from the beautiful ancestral homelands of the Beothuk and the traditional homelands of the Mi'kmaq. My role in the sort of realm of housing, homelessness, and healthcare is as a researcher. I have a 14-year career so far in research, collaboration, advocacy, and publishing in Northern housing, homelessness, and social determinants of health. And I'm also the project director for At Home in the North, which is a large partnership between Northern and Indigenous communities, NGOs, multiple levels of government across the Canadian North, and community and university-based researchers working collectively and collaboratively to address the Northern housing crisis. Thank you.
Great, thanks so much, Julia. I'm going to move to Ian to introduce yourself, and just a reminder to take yourself off mute.
And a very good day to everybody, and thanks for allowing me to participate in today's session. My name is Ian DeYoung. I lead the group called Org Code Consulting. We provide support, training, and consultation services to system managers and system planners, as well as government and community-based organizations and homelessness and various types of housing with supports. I'm coming to you today from Oakville, Ontario, the traditional land of the Haudenosaunee and the Anishinaabe, but I don't think I pronounced those right, and I need additional support in my cultural learnings. I'm the author of the Pandemic Response and Recovery Toolkit for Homeless System Leaders in Canada for the Canadian Alliance to End Homelessness. I'm also an advisor to Built for Zero Canada, which is the national movement to end homelessness through effective diversion in housing. And I do some work with Reaching Home, which is the federal initiative working towards reducing and preventing homelessness in Canada. And I also am a technical advisor and technical assistance to the Canadian Shelter Transformation Network, which is working to reduce lengths of time in shelter with a strong housing-focused orientation to helping people leave shelter for permanent, safe, appropriate, and supported housing as necessary.
Great, thanks, Ian. Welcome. Sophia?
Hi, I'm Sophia Crowe. I'm the Executive Director at Health Common Solutions Lab. My role in this space is very limited, actually. I feel like an interloper among a group of experts, but the role of the lab during the pandemic in the homelessness space has been to support the standing up of the shelter response for those who test positive and are also experiencing homelessness. And so we supported a partnership between the Inner City Health Associates, University Health Network, and the Parkdale Queen West Health Center in determining what design of that model would be best suited to the population during this period of time. And it's given us the chance to learn a lot from our partners, but also for clients and staff who serve the population, and I'm very happy to share some of those perspectives. The lab itself works on innovations in the health and social care spaces, taking a population health-based approach, and integrating multiple disciplines in that practice. So using everything from service design and ethnography and anthropology to traditional public health tools and health policy tools. So thanks for having me.
Great, thanks so much, and welcome, Sophia. And Naheed, can you take a moment just to introduce yourself this morning?
Hi, everyone. Thank you so much to the event organizers today, and to Kimberly, and to my amazing panelists. You guys are so impressive. I'm honored to be here with you. I'm coming to you from Toronto. For thousands of years, it has been the traditional land of the Huron-Wendat, the Seneca, and most recently the Mississaugas of the Credit River. I'm also coming to you live from my exercise room, hanging out with my bike behind me. I wear a few hats and have been working on the housing and homelessness crisis for several years as the founder and lead physician for the PEACH program, Palliative Education and Care for the Homeless program, a mobile, supportive, and palliative care program that aims to meet people's needs who are homeless, dealing with serious life-limiting disease in shelters, on streets, under bridges, so no person falls through the cracks. The program has understandably grown, and there has been a greater need than ever. Our caseloads have doubled during this time. We conduct grief circles for staff who support people experiencing homelessness, and our team has been catapulted in providing grief circles to support the grief of people who are working in Toronto's program to support people experiencing homelessness with COVID, and that has been, really putting us at the forefront of that. I also serve as the medical director of the Region of Peel's COVID-19 homeless response, so the city of Mississauga, Brampton, and Caledon, where I was brought on by the Region of Peel to develop a COVID program to respond to support people experiencing homelessness, upwards of 1,400 on any given day in the region, an isolation program, a recovery program, pathways to housing. I work as a health justice activist, and I'm quite passionate that actually COVID has proven that we can cure homelessness, which maybe is part of the reason why I'm included on this panel today. Anyways, I'm very much looking forward to the conversation. Thank you.
Great, thank you. I'm looking forward to the conversation as well. I think it's fantastic, the knowledge and the experience that we have here in this panel. I'm going to start us off with some questions just, in my own mind. I think there are some technical questions that I'm interested in hearing, and the first one is about the different naming that's appearing in this space. So I'm going to reach out to Ian to start us off. But, what's the difference between homelessness and houselessness? So, one referring, I guess, to a social connection or a community, and the other referring to the actual physical structure. Do you want to start us off, Ian?
I'd be happy to, and just starting off. I think one of the things that's been really clear in practice of communities is that social and community integration has to be one of the cornerstones of all of the work that we do, and is one of the things that is fundamental to the application of housing first and ensuring that it isn't housing only. And so if we think about effective responses to homelessness and we think about housing as the cure to homelessness, we also have to think about the supports and mechanisms that allow people to meaningfully engage with community and other people that they choose to affiliate with, that they form bonds with and feel a sense of support. So that's one perspective. Another perspective that I'd offer is if we think about the great work of Jesse Thistle in helping us understand definitions of Indigenous homelessness, and we think about how many people who have been displaced from their ancestral homes and traditional lands and have migrated to different parts of the country, I think we also need to think about what does that lack of connection mean from a cultural perspective. I'd also offer that in the space of youth homelessness, we need to think very critically around notions of homelessness and houselessness and the trajectory into homelessness of young people who might have left different places where they perhaps didn't even have affiliation with notions of home. And the last perspective I've offered to kick us off is we must also be cognizant of survivors of domestic and intimate partner violence and the disconnection or the recreation of home that is required as part of the recovery from that experience and needing to flee homelessness. So I just think that to start us off, that yes, we need to be looking at housing as a solution to homelessness, but we also need to be looking at it as a cure to houselessness. And the technocratic aspects of helping someone achieve and access housing is not easy, but it is relatively formulaic. The recovery from not having a place of home to a feeling of location, space, place, and connectivity is usually a longer duration than what most homeless service providers can provide, but certainly falls in the realm of housing support providers to continue to cultivate those connections.
Great, thanks so much. I'm going to jump to Julia and see, do you want to build on some of those concepts of connection and support as important components of the issue?
I mean, I think Ian provided such a thorough and comprehensive overview of the various sort of streams of thought in terms of the homelessness versus houselessness discussion. I mean, I would say that I think that the pandemic has really underlined, certainly in the North, the necessity for those long-term supportive housing programs, ones that are looking at home in that very kind of, as a complex constellation of factors that give one, a sense of place, a sense of belonging. And I think to go further as well, I mean, Ian very rightly pointed out the work of Jesse Thistle, and I think again when we're looking at responses from Northern and Indigenous communities, we're seeing many examples of the need for direct funding to Northern communities to be able to be able to determine pathways forward in terms of supportive housing that are contextually and culturally appropriate and responsive to local priorities and local needs. I'd also say in research that I've done with people with lived experience that one of the problems that I have with the term homelessness sometimes is that often we can overlook the very important senses of home that people with lived experience have, whether that's with chosen family, friends on the street, in the shelter, support providers that are of particular significance, relocating to be closer to children who might be in care. There's a wide variety of different sort of examples of ways in which people with lived experience are building and seeking home. And I think that that's an opportunity for support providers, for policymakers to look at what are those homemaking elements in people's lives and how can those be promoted, supported. And we're seeing that through Housing First and other supportive housing programs. But it's complex, and I think it's worth our while to look at it both from a homelessness and houselessness angle and keep in mind the elements from both that are useful.
Great, those are great perspectives. I'm thinking about Naheed and his experience during the pandemic, and I'm wondering, can you tell us a bit, Naheed, how the pandemic has changed the work you're doing?
Yeah, absolutely. Thank you, Ian and Julia, for your comments earlier. I just actually posted 2 links to Homeless Hub on the Canadian definition of homelessness and the Indigenous definition of homelessness that might ground us in the conversation. Certainly, I represent a network of health workers and organizations across the country in different jurisdictions that have had to respond to the homelessness crisis, to the opioid death crisis, which are pandemics within themselves, and then the pandemic of COVID-19. And what's interesting is depending on the region you're coming from, whether you're coming from Victoria, BC, or Saskatoon, or Ottawa, or Toronto, or the region of Peel, it's very dependent on the history of the local organizations, how they operate. Is there a history of a homeless health entity? Like I work at the Inner City Health Associates in Toronto, a long history, working with Sophia and her group to develop that COVID response program, whereas that history doesn't exist in a place like region of Peel. So what we've seen is jurisdictions, sometimes governments, working collaboratively to come together to develop programming. No matter what jurisdictions you look at, there's usually been a response across Canada for people experiencing homelessness, which often involves an isolation program, which allows people who, through a trauma-informed approach, for people experiencing homelessness to get testing and be in a safe space. Many of these programs across Canada offer trauma-informed approaches to care, harm reduction, case management, and then there's, of course, a COVID recovery positive program where people test positive, they go into that program, and with different kind of structures as well. In the region of Peel, what we've developed is these 2 entities are within one building, like a hotel, for example, and it allows for cross services to work together. So we've seen this kind of programming develop. We've also seen the work take a different level of intensity. We're having, in the province of Ontario, over 45 people die of opioid overdose per week. We are dealing with more death, morbidity, mortality, and suffering than ever before. And one of the things that I've personally been involved in, I mentioned in the introduction, is supporting colleagues who are dealing with grief, moral injury, and compassion fatigue. I don't like saying burnout because I think it sends the wrong kind of overtones of what's actually, or undertones of what's actually happening. What we're seeing is compassion fatigue, and we're seeing our colleagues working day and night, abutting against systems that often lead to system failure because of systemic issues and gaps in our systems. And so I'd say those are 3 major areas that the work has evolved and developed over time from a health perspective for people experiencing homelessness.
Mm-hmm. Yeah, that's a huge insight into what you're dealing with and coping with. I'm wondering, Sophia, do you want to add from your experience with Health Commons and some of the innovations that you are introducing during this time?
Yeah, actually, if it's okay, I wouldn't mind going back to the previous question, which is around the question of houselessness versus homelessness. And actually, the lab has had a longer history working in that space with populations that are either street involved or they're sort of been recently rehoused in transitional housing. And the purpose of that work was really to understand, like, how can we find ways to support the community in building connections so that they can move away from the sense of dislocation to connection, which is a critical aspect to making that housing situation stickier, right? And what we have found is a couple of things that are really interesting. Some of this work I have to attribute to the In With Forward group, that's a social innovation lab out in BC, whose work we have picked up and we've continued on in the Toronto context. But they spent a lot of time trying to understand through the narratives they were collecting among frontline staff in drop-in centers and clients who are frequenting those drop-in centers, what role community was playing in keeping people in place rather than moving into more sustainable housing circumstances. What role was community playing in that instance in making it unattractive to leave the safety of that connection and move to a different location in their housing journey? And one of the things that really struck me about it was that there was a need for the system players and the staff to interrogate what role they were playing in failing to support people as they move through the transitions. And I think failing to support is probably not the right language, but really what they talked about was that staff saw their role as meeting people where they were on that day. And that was the most critical aspect of their therapeutic relationship with a client. But many of the people who had negative outcomes were going through a change process, and that change was not a focus of the clinical intervention of the client relationship. And so that created a lot of disconnection for them as they were moving into housing circumstances. And what it requires, I think, is a little bit of a focus of the system, understanding that they can't actually be all things to all people, and to look across the spectrum of resources and assets that we have, and to see these individuals and peers as a very important resource for building resiliency, community, and a sense of participation, and to think creatively about how the systems can support that. So I just think that as we move into a situation where many people were rapidly rehoused during COVID, and we are trying to find ways to make that stable, an important aspect of this is going to get the healthcare partners and the social care partners to think very creatively about ways to support community building, as I think maybe one of the first priorities. We have found spaces. We have not solved it, but we do understand now that there is a structural response to the houselessness problem, but the trauma and experience that many of these clients have gone through can only really be resolved through, I think, community building and a sense of connection. And the conversation probably needs to quickly transition to that space if it's not already there. Sorry, and I didn't answer your second question, Kimberly, but it is just an observation of the connecting what was going on pre-COVID to where we're going to be heading post-COVID in the recovery process.
No, that's great, Sophia. I'm just going to also, let the panelists know if you have something you want to jump in on the conversation, just give me a little signal there. I'll be watching for you. But I think I may go to Ian next, and just what can we expand a little bit on this conversation around the compassion fatigue, and then also, picking up on some of Sophia's comments about how this is a system-wide problem, and how do we reach out and create those connections and relationships that are supportive of, the multitude of priorities that are out there for us on homelessness.
Thank you for the question. I think my observation would be that we're seeing different processes play out in different parts of the country in that regard. And to pick up a bit on Nahid's point, I think one of the things that I'd say has been an important observation has been smaller communities that haven't had necessarily an infrastructure of homelessness and housing supports historically, that have entered into the space without some of the, lack of a better phrase, historical baggage. So it's presented an opportunity for different partners to come to the table to figure out things like, how do we deal with an effective response of sheltering people when we don't have a shelter in our community and we might have, one or two motels, and who supports that? Who staffs it? How do we bring in health resources into that space? How do we bring social work resources into that space? How do we bring income supports into that space? And some really creative problem solving. The urgency of the crisis resulting in solutions that certainly in the conversations I've had with some people, it's led to a bit of a why haven't we done this historically, which if there's a positive that's come out of some of these instances, that would be one of them. The other thing that I've seen that has come up just relative to the compassion fatigue is in some of the larger facilities in the country, they were, upon reflection, a bit overwhelmed at the beginning, right? So they didn't necessarily know how exactly do we enter into the space, and so they were going a million miles an hour just trying to do the right thing without knowing what the right thing necessarily was. And if I think back to those early days, those first few weeks, those first couple of months, a lot of panic phone calls, has anybody figured X out? Because we're just drained. We just don't have anything left in the tank, and if there's an answer somewhere, we'd like to find it. And how those organizations, through a process of realizing that supporting the people doing the work was also important, along with supporting the people impacted by homelessness, and really taking the time to honor the contributions of staff in that space, which I would say has led to some really fantastic outcomes in some places relative to housing access, housing support, but also bringing in more community partners into that space that is breaking down some of those silos. And I would say moving forward in this space, it's my hope that we don't lose some of that synergy that's been developed in this space, that we know how to support each other, not just relative to specific program participant or people experiencing homelessness and meeting their direct requirements, but learn how to support each other, not just as people, but as organizations that share the space of trying to come up with housing focus and effective support responses for people experiencing homelessness.
That's great. I'm thinking about, Julia, and some of the work that you have been doing with communities in the north, which are smaller rural communities, and probably going through some of the challenges that Ian spoke about in terms of not having shelters. Is there any stories there, or any particular innovations that you want to highlight from that experience?
Well, I mean, I would highlight a project that you and I are both very familiar with, and that's the Arnica Inn harm reduction supportive housing program in Yellowknife that has been put together under the pandemic, the first of its kind, linking a managed alcohol and cannabis program with supportive housing. So an example of the pandemic and the need to quickly move to address challenges around the ability of people experiencing homelessness to shelter in place, to see different actors coming together quickly in order to facilitate that, and of course through the leadership of the Yellowknife Women's Society. And that's something that we see, especially in the northern capital cities, some really interesting collaborations between Indigenous and territorial municipal governments, the nonprofit sector, in some of these new kind of new relationships like Ian was discussing. Here in the context of Newfoundland and Labrador, in Happy Valley Goose Bay, the Nunatsi government, for example, plays a leadership role in the delivery of the emergency shelter in the community of Happy Valley Goose Bay. But in contrast to what we've seen in Yellowknife under the pandemic, in Happy Valley Goose Bay, there's been this real urgent push toward sheltering people, and there are people that have been staying in the Lab Inn in Happy Valley Goose Bay since the beginning of the pandemic. So local government paying for the hotel costs of a not an insignificant number of people who were staying at the hotel there. And it kind of touches on what Sophia was discussing in terms of the sort of focus on housing, but then what next? And in the context of Goose Bay, there hasn't been, as we've seen in Yellowknife, a kind of movement toward harm reduction and toward what, imagining what supportive, long-term supportive housing could look like in the context of that small community. And so, there are tremendous challenges to finding available properties that can be used for supportive housing programs under, very short timelines. And even in the long term, this becomes a constant issue, finding space to be able to offer programs, and then funding, and then who is ultimately going to be responsible for administering the programs. And that's where we're seeing some kind of interesting new players, for lack of a better word, coming into program delivery. Other examples, we can look to Inuvik as well to see that the ways in which the Inuvialuit Regional Corporation, Gwich'in Tribal Council, and the Niitak Gwich'in Band have played important roles in addressing homelessness in the community. But in terms of innovations, I really, people have been talking about harm reduction in connection to supportive housing in Yellowknife for a very long time, and it was finally under the pandemic that has been made a reality. And so the concern or the interest now is, well, what happens next, and how do we ensure that the successes of this program continue forward in a post-vaccine world, because we can't return to the way things were before.
Yeah, I'm gonna jump to Naheed here, and just if there's anything you want to pick up there in terms of community engagement or partners that are coming to the table, and Sophia as well, just give me a signal if you want to jump in on that conversation. But then we'll move into maybe also talking a bit about system resiliency and how do we respond over the longer term.
Yeah, I think in my little corners of the world, I've seen that organizations and community is more responsive to this issue of help supporting people experiencing homelessness than ever before, and that's why I am convinced that COVID-19 has proven we can cure homelessness. We were before the pandemic, we were told different levels of government can't work together, budgets are not that can't adapt that quickly, where the system's not that agile, and look how quickly people were able to come together, whether in jurisdictions in Canada with a lot of cultivated history, and to Ian's point, in other places where this is sort of novel. On a sort of continuum, we've seen people be able to work together in ways that we haven't normally. And I might miss some categories here, but broad strokes, I'm seeing local governments get involved. I'm seeing healthcare get involved. So our acute hospitals are in some jurisdictions involved, but our community health providers are more connected than ever. Our housing providers are recognizing the connection that's needed to health. And I am a physician, so I'm trying to add the health angle to this conversation. And I think all in all, we're seeing this as part of a recovery plan. And I think the Canadian Alliance to End Homelessness Recovery for All campaign, it is a campaign, but it is a plan that I think is very worth browsing. I'll post the link shortly, and it speaks to sort of the energy. There's an excitement that, albeit we're in a pandemic, it's doom and gloom, it's sad days, and it's very tough, and people experiencing homelessness have taken on the brunt of it. But maybe this is our blueprint out of this thing, and it's the responses from a health perspective, as someone who's working on the front lines, that really I see with my own eyes that excite me about that.
Yeah, do you want to jump in, Sophia?
Yeah, sorry, I realized I wasn't on mute, so I was like, yes, enthusiastically agreeing with Naheed. I think, I'm really interested in this idea of fractals, which is sort of like the tiniest unit of the biggest picture, right? And so things that keep replicating themselves. And so I agree that that while we have seen like tremendous loss during this period of time, there is also, I think, like what is emerging from this is really good examples of the complex nature of the response that needs to happen, right? We have seen like many different organizations leaning into a space and partnering in like absolutely unprecedented kind of ways. And I think to Julia's point, the important thing is how do we now take everything that we have seen here and translate it into the structural change that we need to continue and move forward as we recover. I think I would just offer a couple of observations around I think what moves both the public, the related partners, and the decision makers to meaningfully change the conditions. And so, I think everything, power dynamics, resource flows, programs, relationships, everything flows out of a worldview. And we've had a particular worldview about how we work as experts in silos, where we get really good at doing our piece and then we hand it off. We have a worldview about whether or not we could solve homelessness. We have a worldview about what the actual problem is, and we often believe that it is a lack of affordable housing stock, when we understand that it is much bigger about community building and how people make a place a home. We have a number of, I think, worldviews that have largely held the problem in place, and now we need to shift that. Now we actually need to convene the conversation about what we've learned about the complexity of this problem and some of the very interesting solutions that have come out of this. And I think it is a combination of really clearly identifying what we were chasing in terms of an objective, right? So the shelter in place is a good example, right? If you look at the shelter in place for people experiencing homelessness and are COVID positive, and you mistakenly think that that is a way to reduce transmission, rather than really describing the objective there, which is to keep people in place for the duration of time and to create the conditions in which they can recover, then you may be looking at the wrong metric. So really clearly articulating what is the specific intention of an intervention. And then there's a narrative component to it, and I think the narrative is really, really important in landing what is different about this experience. And one of the things that I've been excited by in the response is that I think when there's a lot of ambiguity and many people are saying we actually don't know what the answer is, different experts are able to emerge in those spaces. In our time interviewing residents and folks on the ground, one of the groups that emerged as a critical member of the team were the peer support workers, who in many instances in the past have sort of been thought about as, it's at worst cheap labor, at best maybe workforce reentry kind of program. But actually what we've seen in this experience is that nobody has been able to do what peers have been able to do in terms of meaningfully support people through a really traumatic experience of being both without house and also COVID positive, and their ability to plug into the experience of these individuals and empathetically guide them through that has really transformed the care experience. And so I think that the narrative allows us to identify what is different. People's stories really do anchor this change in a meaningful way. And then I think that there is some effort that needs to go into saying governments absolutely play a role. There's no question about that. Let's get specific about what the expectations are for how governments are going to fulfill that role. And to be bold about the expectation of much deeper connections at the government level between ministries, between programs, in the funding expectations. That may be one of the critical expectations, is how deeply partnered a response looks like at the municipal level. So I think those are some of the thoughts that I have around zooming out, around describing what change you're looking for, and then zooming in on the specifics of these changes, the stories that come along with it, and the data points that are proving out sort of what we had intended to start and achieve during this period. I think those things can help to change the conditions going forward.
Great. Yeah. We've got a question in the chat from Ivan, and maybe I'll put it out to either Ian or Naheed if you want to pick up on this. So what are the best strategies to address municipal authorities' resistance to develop housing projects, so and to increase social acceptability? Do you want to take a stab at that one, Ian?
Oh, I'll defer to Naheed on that one to start.
Okay.
Well, it's a really good question, and in an era of NIMBYism, which has reared its ugly head during this pandemic in a lot of places in Canada, sadly, right? This is very important. I can speak from a health perspective, and then I wonder what others think about other perspectives. I would say that to develop COVID response programs, you had to kind of really zone in on this issue, and it's a public issue and you're using public dollars. There's no denying that. And so I think one of the things that's come up, and you know about stories, I'm sure, in the media from Toronto, for example, where people were literally protesting the presence of shelters, responding to, respite shelters and drop-ins being closed and having to develop more programming around that, is to look at your internal champions and your external champions. So when you're working with government, particularly municipal government, really identifying internally who are people who have understand the root causes of homelessness and the systemic causes of poverty, who have a track record politically of showing that will, and build alliances and relationships with them. That's not just the politicians, but their staff. Program officers, people who collect data at the city, at the region, and really building those inroads. Then externally thinking about, who are external champions in your local communities, thinking about the places I work. It's been everybody from a board of director member at the hospital to, an emergency department lead, clinical lead, to anybody in between, who's been able to recognize and see what homelessness can do, particularly in a pandemic, to people, and how it presents at their doorstep, essentially. I think then being not afraid to address NIMBYism head on and really understand that there is a public relations aspect to this, and I've been on the forefront of this in a few ways, and being really evidence-based about what you're offering, understanding the social return on investment, and there is some research to show that the social return on investment for harm reduction programs or housing programs, for example, in a particular region, and not being afraid to be public about that controversy and presenting facts. I do believe Canadians are compassionate. We have seen compassion override, feelings of NIMBYism in several interactions that have occurred across Canada. And I'd say, at a broad strokes level, those are some tangible steps to think about that are practical.
Great. I'm going to turn to Sophia and then to Ian to pick up on some of those comments.
I want to tap into what Naheed is talking about building off of empathy and the opportunity for empathy. I think that people need to have the chance to have something to respond to. That, I think in many ways is the hearts and minds thing, especially in urban environments. We're pretty landlocked, so every solution means you're going to be in somebody's backyard. And right now, I would say in Toronto, we have a conversation that's being dominated by Facebook groups, largely populated by a middle class parents who are unhappy with the presence of a shelter response in their communities. What is missing from that narrative actually is the stories of, people who have, in many instances, I know in the Bond Street Hotel in Toronto, there are people who have been homeless for 20 years who are experiencing their first stable housing in that period of time, and it's fundamentally transforming them. In the conversations that I've had with local staff and people who check in on them, peers, it's a deeply personal experience that I think we need to tell. And so I think it is partly a PR kind of campaign, And we need to find ways to flip the narrative. So, I'm looking for a filmmaker right now who will help go in and document some of the stories. The primary complaint has come from, actually a church down the street who doesn't like the presence of this facility there. And I think that it is really important to tap into the things that motivate people towards change in the languages that they speak, because it's a matter of, in many instances, I think, helping everybody to understand that our spaces are for everyone. And so I think we need to get creative in telling those stories. I think we need to use every medium that we can. I think data is really important. I think there's a rational argument to be made. There's a public policy argument to be made, and there's a really human argument to be made, and we need to push on all those fronts.
Thank you, Sophia. Just highlighting, how important the dialogue is around this, and how with the pandemic this has become much more a part of the conversation, and to be sort of cognizant of the fact that if that dialogue is missing, that social acceptability piece is pretty hard to address. Ian, do you want to pick up, make a comment?
Yeah, I deferred in part because the question hit a bit of a nerve, having been involved in supporting some supportive housing projects during COVID. And it's just I have found, generally speaking, that there's a lot of municipal staff who are phenomenal advocates for supportive housing and championing innovation in the space of trying to figure out ways in which we can really truly meet the needs of people who have experienced homelessness in integrated fashion. That said, it doesn't come without getting its scars. And to go enter into the space of talking about supportive housing, you have to expect that there could be municipal politicians that are also on board, but once there is this kind of coalescing of a voice in opposition, you can track the progress. They'll attack the idea, then they'll attack the process, then they attack the person, and it kind of follows through that. I don't want this thing. I don't like how you did this thing. I don't like you. And I think that what we need to do is, instead, we're often in defensive mode in that. I think the opportunity here is to find more champions who are proactive in the space, who are more interested in getting involved, not just because it is their neighborhood, but because they think it's the right thing to be doing for our broader community. And so lending voices to those municipal staff and politicians to let them know, that yes, you're going to hear voices of opposition, but there's a cohort of us who stand behind you, who are with you, who will shoulder this load with you, may create impetus for more municipal leaders to enter into the space if they know they're not just going to get slammed with opposition, but they will actually have support in the space as well.
Thanks for that, Ian. I'm wondering, Julia, what's your experience with municipalities in the north? Is it some of what we've been hearing from the panelists? And then I think I'm just cognizant of time as well. So I am going to get people to start thinking about just one last question, in terms of what do we need to see from this, in terms of like transformational leadership, just to wrap us up. So Julia, do you want to talk a bit about the northern piece in the dialogue?
Yeah, absolutely. I mean, NIMBYism is absolutely alive and well in northern communities as well. And I think in part, especially when we look at regional centers like Yellowknife and Whitehorse, Iqaluit, Goose Bay, I mean, those are communities that service the entire region and provide a lot of important health and social supports, but then also are the sites of emergency shelter housing. So that's where that's where shelters are. That's where, if there are transitional or supportive housing programs, that's where they tend to be as well. And so the visibility of housing insecurity is amplified given the small size of the communities, the small population. And I mean, again, we've seen in terms of social acceptability really coming from interagency and intergovernmental collaboration. And when that works well, and when you have champions both in the nonprofit sector as well as in Indigenous government, municipal and territorial government, you see that reflected, I think, in public sentiment. But one of the things that that I would highlight again, in terms of building long-term public support for housing and supportive housing, is really the evaluation component of what has been put into place under the pandemic. And again, looping back to the Arnica Inn program, but then prior to that, it was a 30-day managed alcohol program that was implemented very quickly under the first wave. Media played a very strong role in communicating to the public the outcomes of that program in real time. And so it gave the public an opportunity to see that this was a program that was actually, according to not just program providers, but also residents of the program, that it was working. And there was a lot of this sort of the narratives of a sense of home and belonging that people within the program were feeling, and that they articulated through media. And so I think we saw, a greater, more rapid acceptance of that program, because people were hearing right away that this was having an impact. And so we have the opportunity now through research to evaluate some of these programs, both quantitatively and then also qualitatively, to tell those stories of people experiencing homelessness, to be able to communicate that to the public, to show that these initiatives have worked, and again, to kind of tap into that heart and soul, that Sophia was underlining.
Mm-hmm. So Naheed, do you want to offer some last comments on some transformational leadership components of what we're seeing?
Yeah, for sure. I would say that everybody on this panel, you guys are all transformative leaders, so listen to these folks for sure. I would also want to hang my hat as a final thought on the Recovery for All campaign through the Canadian Alliance to End Homelessness. Colleague and I wrote an op-ed on a 6-point plan that the Recovery for All campaign covers, and I think it's a worthwhile review. I think one of the first things is we need a federal commitment to end homelessness with specific timelines and targets. We got that in the throne speech, so we actually wrote about that before the throne speech, and then that happened, so that was really great. But what we didn't get in that was specific commitments to the definitions of homelessness, recognizing the Indigenous definition of homelessness and how homelessness is experienced by women, youth, and Black and other people of color, which is also crucial. The second point is we need to think about mechanisms to alleviate poverty through income support. So a basic income, universal basic income. I know there's a lot of pros and cons. I'm not a basic income expert, but I recognize that is an important piece of this. Number 3, we need to expand the affordable housing supply. So there's more than 370,000 new permanently affordable housing units that are needed to meet current needs, and they just don't exist. Number 4, while the government of Canada has recognized housing as a human right, there is yet to be this oversight structure that's needed to protect people, and we got that in the throne speech again. So they created a National Housing Council, I believe, but they haven't actually named the person or the plans or the accountability associated with it, so that's kind of in motion. Number 5, we need to prevent the erosion of our existing naturally affordable housing stock by stopping large capital funds like real estate income trusts from buying up rental housing units. So that's affecting the housing supply. And then number 6, we need to address the fact that Indigenous people are dramatically overrepresented in populations of people experiencing homelessness, and they need autonomy, support, and they need to be they need to be given the resources to develop and implement adequately resourced and distinct housing strategies for urban, rural, and northern Indigenous people. So I hope these 6 points are helpful. It's encouraging to have seen some progress already. I'll put the link in the chat, and thank you, everyone.
Great, thanks so much, Naheed. Sophia, last comments, anything to help wrap us up?
I'm looking at the time quickly. I think I'm just thinking of this from a policy and a politics kind of perspective. And so I think Naheed's done a beautiful job of describing the policy, like things that we need to advance. And I think having all of those points at our fingertips so we can continue to advance the common agenda is really important. And then on the politics side, it's always a bit more complicated, right? And this is where actually I think transformative leadership really comes into play. Peter said you did some work around, what does transformative leadership look like? We talked about it in our pre-session, and there's a few pieces that I think are really important to draw out in terms of what leaders need to be doing to come into this in one way and exit in a different way. And I think one is that there is a moment of reflection right now. We're doing it kind of in a fast track sort of way, but thinking closely and carefully about how we changed our own positions, how we worked in different ways, how others worked in different ways, and to reflect deeply on what that tells us about the art of the possible. And I think we have this tendency to not want to have the cognitive dissonance of believing one thing and doing something else. So if right now we're working in a highly networked and integrated kind of way, we need to realign our thinking to believe that we can always do that, even beyond an emergency. So reflection is a key part. I think being able to convene, help people see the complexity of this problem and to have a conversation about the complexity, to really complicate the binary ways in which we look at something. It's either X or it's Y, and to get everybody contributing their perspective. And when I say everybody, I mean everybody. I mean clients and peers and staff, policymakers, politicians, citizens, residents of these communities. I think we need to be involving everyone in the conversation. And once they're there, actually, it's a new practice in many ways of co-designing what the solution looks like. So we have been pulling from the toolbox because we have evidence that it works in other places around the world, but the contextualization of those interventions in our own spaces is going to be really important. And inviting as many people, especially those who are on the receiving end of these services, into the design space to talk about what it should look like, what it should feel like, and what would feel sustainable, I think is going to be an important path forward. So that's the politics side of things. It's just thinking about leadership and what it demands of us in this moment.
Great. Thanks so much, Sophia. I'm going to move to Ian just to give us some final thoughts, but also I'm going to ask the panelists, we did have one question on considerations for homelessness among seniors, so if you have any good references to put in the chat, that would be helpful. We won't go into that question, but just see it there. Go ahead, Ian.
I think in the space of transformation, we need to work in systems at the same time that we're working on systems. And we need those things to happen in parallel to each other and be complementary. And the left hand needs to know what the right hand is doing. So that's the first thing I'd offer. The second thing is, I think now is also an opportunity to lean bravely into the space of innovation. So yes, things that we know work and we have evidence we should take to a scale that we haven't had before. But we must also acknowledge that there are things for which we don't have an answer. And we need to rely upon our best ideas to create that new place, that new space, that new opportunity, that new form of engagement, that new type of housing, that new type of support, because we may not get another opportunity like this to try to figure some of those elements out. And we need to, I think in the space of transformation, take the time to acknowledge that which we've already learned, and in particular some of the silver linings that have come out of this, whether this is smaller communities that are entering into the space, but then leveraging some of those new partnerships in new ways. So for example, that might be complementary to this conversation. For a long time now, we've had non-clinician staff who do a lot of the lion's share of support work for people in housing, and we haven't necessarily seen throughout the country strong integration with health systems in that component of the work. And so I really see that as an opportunity of leaning in and figuring out what more can we do in that space, and how can we take some of the good examples that do exist in parts of the country and bring those to scale.
Great. Thanks so much. And it looks like we are going to finish up on time. I am just going to take this opportunity to thank CFHI for hosting the Spotlight Series and highlighting some of the important issues that we're facing during the pandemic. I want to thank our speakers so much. I've really enjoyed this session and I've learned so many things. I just really appreciate you taking the time to join us and share your experiences and your expertise in this area. And talking to us about relationships and why they are so important, how to recognize and align the right policy levers. And you've shown us what is possible and hopefully what will continue to be possible in the area of homelessness as we move forward with a committed group of people. So thank you very much.
Thank you, everyone.
Thanks, everyone.
Thanks,
Bye.
everyone.